Convening this work session of the Anchorage Assembly regarding 2025 alcohol tax funding goals and priorities. We're on the record today we're scheduled today from 1 to 2 p.m. It's Friday, July 26th. We'll start with introductions. Mr. Walland.
Daniel Volland.
Mark Littlefield.
Scott Myers.
Anna Brawley.
Meg Alochol.
Christopher Constant on the phone. Ms. Bronga.
Yep, thank you.
Thank you, Mr. Rivera.
Present.
Thank you, Mr. Salt.
Here, thank you.
Thank you, Mr. Johnson.
Here.
Thank you. And with the also with Legislative Services, Claire Ross, and Financial Analyst Matthew Farina. With the administration, we have
Graham Downey.
Joe Busa, Deputy Municipal Attorney.
and you have a tag in front of you that says Gardner, but well, we recognize that is not the case. Okay, so today we have a work session on our alcohol tax funding goals. So we're starting the conversation about unifying our priorities between branches as we move towards the budgeting process for the next year. The goal, at least one of the goals, is to have a harmonized budgeting process so that the introduced item with changes becomes the adopted budget instead of a wrestle at the end and a final adopted version that arises out of conflict. So I want to welcome everybody. I want to remind everyone the purpose is to learn from sponsors and experts in the field, as well as to give assembly members an opportunity to ask questions and learn more about the legislative topic in front of us. Not a place for debate, etc. Thank you for being here. Over the past few months, the Assembly has been reviewing the draft strategic plan for alcohol tax revenues, and that process has led to the creation of the draft action plan that you have in your meeting documents today. At our last discussion on June 13th, Rules Committee, we committed to taking steps into the action plan by holding a work session for the Assembly administration to work through the evaluation rubric in this action plan to evaluate success and set goals for 2025. That's what we're starting on today. I can't say we're going to do that today. For the discussion, I'm going to start with Ms. Brawley. I would note Mr. Martinez joined us just now.
Yeah, thank you. And I know we only have an hour, so I will stick to the script here and also make sure that we have some good dialogue. So thank you, Mr. Chair. For today's discussion, what we're going to do is go through the list of questions in the annual evaluation rubric in this draft plan. So if you go to the back page, page 4, that's what we'll be looking at, and that's what I'll be walking you through. So there's also some suggested changes, edits to this plan, the draft action plan that were made at our June 13th rules meeting. Those are in blue. One of the suggestions is to change this from a quote action plan to policy guidance. You know, again, getting to this discussion about how we use this guidance and how we want to characterize it. So we're going to save some time, hopefully at the end of today's work session, to discuss those suggested edits. But the main purpose is to work through this rubric and really think about, you know, where we've been with alcohol tax, and then looking ahead to the 2025 budget, what those priorities should look like. And so if you have changes to make to this action plan and we don't get to them, please just send them to staff, to Claire. And then we also want to note that this is Anchorage's plan for the alcohol tax, not just the Assembly's plan. That's really what we're moving toward. And so in some of the recommendations and pieces of this plan and this policy guidance belong to the Assembly, some belong to the administration, especially around how the money actually gets out the door and is utilized throughout the year. So we've also invited members of the administration here to participate. We also understand that you all are new and you're catching up, and that you might not have answers to all the questions. So I think our goal is to raise some questions, have discussion today, but not that we're going to, you know, solve all these questions today. And then we also want to make sure that we're thinking about how to shape or, you know, what the approach will be to craft the 2025 budget for alcohol tax revenue and what the choices will be in there. So please feel free to participate. And then moving ahead, we're going to go ahead and start with this rubric, and you'll see there's a series of questions. And so I will do my best to facilitate, and then Mr. Chair is managing the queue as far as walking through these questions. So I just want to note a few things as we look at all the budget information. You've got your other handout, this paper. It has the high level, kind of where the money has been spent, and then you'll see a much more detailed list. The goal is not to get into individual line items today, but please feel free to review those, and it gives you a good sense of where we've been. But I want to give just a couple of big picture things to keep in mind. So one is that we're only in year 3 of this tax. So it passed in 2020, it started in 2021. So it's still pretty new, and we're really building it as we go, right? So there's opportunities to improve what we've done, to think broader about that. We've learned a lot about what works and some things that haven't worked very well with this tax, in terms of funding, how it gets out the door, et cetera. But that process can really happen alongside the budget conversation. So there's a lot of things that we've talked about in terms of how grants get made and things, but we want to really focus on the budget discussion today, at least with this rubric, but those things are also relevant. And then I want to note that we've funded some really big things with this tax. We have funded until this year the mobile crisis team and the mobile intervention team in the police department and the fire department. We funded pre-K classrooms at ASD. We funded other grants for early childhood. We funded the Next Step initiative, part of the funding that went toward the housing initiative there, other housing investments. And then most recently, funding a portion of our safety center and patrol contract to have a higher level of service that's more focused on medical. So these are really things that I think we should be proud of as a community. These are in my opinion, at least, good choices that we've made, but we should not feel constrained by just the choices that we've made so far. We want to think about moving ahead. Okay, so let's move into the rubric. So looking at last year's funding goals and success, and really the last 3 years, that's the information we have. We don't have a lot of data from these, and so you'll see in the rubric it mentions goals and metrics. Those are things that we're still working on, but I think we can still reflect back and see, based on what we have, the where the money has been spent. What kind of trends do you see? And do you feel like the money was allocated well? Did we make good choices that have positive impacts? Are there things where maybe we wanted to have an impact or we didn't? But really thinking about, did we meet our goals? Or at least in this sense, until we have some of those more specific goals, do we feel like that we are achieving what the community wanted from this tax in these first few years? And so I'll leave it for discussion.
Ms. Alochol.
Thanks. So can we jump into the evaluation rubric questions about that? Okay. And I think it goes to, are we getting what we want from this tax? What are the goals and metrics for last year's alcohol tax, and did we meet those goals? I'm not sure. I am always aware of what the departments set in those grant agreements for metrics once we make the appropriation, because we aren't setting those metrics when we do the appropriation. And to me, that raises the question of, do we want to set metrics per designated area so that you're comparing either apples to apples, right, with programs within that, so that you're getting an overall snapshot of the bucket? Are you moving toward making an impact on, I'm making something up here, folks, but let's say literacy, right? And so in the early child, literacy is a bad one. For public safety, let's say it's, pick a metric, but then everything in there is reporting on that metric. And we're saying, okay, are these programs moving us towards meeting that metric or not? Versus there's this metric over here for this program, this metric over here for that program, and this metric over here. And maybe those metrics aren't aligned or even coordinated. So I've been thinking a lot about that. Like, we have these metrics and we have these designations, but are we coordinating and braiding and leveraging the funding in such a way as that we're all kind of rowing in the same direction? Or are we actually maybe sometimes working cross purposes? So I've been thinking about that, because I have a hard time talking about, other than in terms of specific programs, what the impact of the alcohol tax is in a broader base. I can't tell you what our impact has been in child abuse, sexual assault, and domestic violence in that area in particular, because I can't say we set this goal and we moved in that direction. And I understand on some of the prevention things, we are at a long-term trajectory, but I can't even tell you incrementally how we're getting there, other than funding kind of the shiny, bright thing that comes to us, or the things that happen to come to the health department, who then I think sets the metrics based on the proposals received and not overarching asking for proposals to meet metrics. Chicken and egg kind of conversation, but I think it's an important one.
Anyone else? So I'll just speak briefly. I don't love the striking of the behavioral health line at the bottom of page 1, only because it's a true statement. And while the tax language was mental health and substance use, the field calls it behavioral health. It's generally understood as such. And I appreciate the change because it was requested up in the mission up above, but I think it would be great to keep somewhere that term behavioral health is the generally defined term for this field that we're talking about. And that's important because when you're talking with the community of anybody who's involved with this work, that's immediately where people go, is the term behavioral health when you're talking about this stuff. So I think it's wise under the mission to change it, but I also think it's good to keep a reference to the understood definition according to the field and the Substance Abuse Mental Health Service Administration in DC. So that would be my one comment at this point. Others, anyone? Go ahead, Anna.
Thanks. Yeah. And again, we're kind of testing out this rubric. So I think some of the subsequent sections will make a little more sense as we look ahead, but I think it is worth continuing to reflect. And then of course, this rubric is intended that this happens year over year, that we look back at the previous year. And I guess I'll offer one more thing that I thought about not saying in the meeting, but another way to look at our impact with this money, at least looking backwards, is absent this funding, what would have happened, right? And I think that's another way to kind of think about, again, not that these are the only choices we could have made, of course, but just, again, remembering that it was able to, this funding allowed us to do a lot of things that we would not have had space to do. But that said, going forward, we want to make sure that we're maximizing impact. So let's move on to, I think what'll be the main part of the discussion is really thinking about the priorities and goals for next year's funding. So meaning 2025. We're coming up on the budget season. And again, we know that there's things that are funded in this budget currently on a recurring basis. Of course, those things can change, but that doesn't mean that we have to start from scratch. There's also things that have been funded on a one-time basis that we could discuss funding another year. And then there may be some, of course, money that opens up because things are one time and are not funded again. So it's just things to think about. But before we get into kind of what those specifics should be, the questions are really, what are our goals for next year's alcohol tax? So they could be, specific to an issue, or they could be, we want to, for example, put more money towards prevention. That could be a goal. What issues do we want to address with the tax funding? Again, it has a menu of options. Like we said, behavioral health is one of them, homelessness, public safety, right? There's this menu that we can choose from, but what do we want to focus there? And then what would be measures of success for next year's alcohol tax projects? Again, not the specific kind of things that would be reported through a grant reporting process, but what broadly do we want to do? So putting those questions on the table for folks to respond to.
Mr. Roland.
Thank you. I think it's really interesting looking at the graph and the different proportions of the buckets. And I know we've talked a lot about on the spotty, a desire to kind of return to more of those upstream investments rather than sort of like emergency response to needs in the community, homelessness, et cetera. I like that we're kind of ticking up in 2024 in some of those other categories, which is great. In terms of determining next year's priorities and what we're carrying over, I guess a question that I have is, so in the past, we've done some recurring grants, and we have had like the unified funding proposal come forward. What are the expectations when we say, okay, something's going to be recurring? I guess I like where Member Alochol is coming from in terms of wanting a measure of success, a metric, and how often I think we could get caught in this trap of where something is just going to recur forever, and that creates this expectation. And so we have to have something to be, a framework to be able to analyze and say, okay, we're actually going to go in a different direction, or we want to prioritize this big project or this other visionary thing, or reshuffle the proportions of the buckets based on needs in the community as they arise. So, does anybody have, I guess I would just ask to my colleagues, do you have any insight into into that when we do a recurring? How long is it for? What is the understanding there?
So it's two parts. One is every year it's subject to appropriation. But two is, and using a specific example, the shelter that we helped to establish for complex care, it'll probably go away if we don't fund it. And so it's not so much, in my book, setting a time frame and saying this is good for X years, unless we did that at the front end of the conversation. If the conversation is, we are going to do this, this is a new priority and we're going to fund it, and those were the terms when we entered into the agreement, then we have to really heavily weigh that as a variable, a factor. And so, but any given Tuesday, we could end that. It just has consequences. And so I think the real question then becomes, in funding streams going forward, we should be careful when we say this is a new priority. We should say up front for an arc of time that we believe it would be a warranted investment for from where we sit today. And it's still then subject to appropriation any given year, but at least then the recipient of it has had some expectation built into the system that it won't be forever. So first, Mr. Rivera, then Ms. Alochol.
Can I follow up
Sure.
briefly? The other thing I think we've talked about is using alcohol tax as a way to be able to pilot projects and see if they're successful. So whether that's something big like the mobile crisis team, which I think we saw really demonstrated success in meeting a need in our community, and then we were able to identify another funding source and move it out of the alcohol tax into the SCMT. And so, yeah, I think there's maybe potential to set up like a couple year project where we can really test proof of concept. And then I wonder, as we get to the next budget cycle, if there's a way that we could bring forward, maybe this is for Matt, the past recurring ones, and sort of what Chair Constant is getting at, what are we going to lose if we don't fund the ones that we've already funded? And so then we can really, I think, have a firm grasp on, okay, what else do we want to do above and beyond that? Thanks.
Mr. Rivera said to let you go first, Ms. Alochol, so go ahead.
Thanks. So I think part of what Mr. Constant and Mr. Volan have both raised is the concept of multi-year grants. And that's been piloted, I believe, in the prevention side of things, where they were multi-year grant agreements subject to appropriation. It's always subject to appropriation, but that provided some continuity, particularly for those ones where the metrics might take longer to materialize into some tangible impact, especially around prevention. And I think it really gets back to having evaluation criteria from go versus not only what are we going to lose, but what are we getting for whatever we're funding, right? These grants require reporting of metrics. And so I think we need to start with, like, what are we even getting as a baseline? And we need to probably have that information, particularly for recurring ones, for the time it's been recurring as we walk into the alcohol tax conversation in the next budget cycle, because I don't know what we're getting for some of them, quite honestly. And it feels like out of all of the municipal budget, this particular fund source appears to be the most fungible, in that we are more likely to change it. And right, I think it's because we understand it, because it's a defined set of money, it's defined categories. And so I think the more we can put process on it where we're measuring, then we can say, okay, for the next, again, subject to appropriation and the assembly doing anything they want to do on a Tuesday night. That's what makes you all so fun. But saying for the next 5 years, we really want to concentrate in the prevention bucket on X, Y, and Z. And we're going to fund programs that do that. We're going to measure that, and we're going to see how we're doing. And if one's falling short, okay, maybe that money's subject to reappropriation. Or we know that something like Crisis Now is really important, and we're missing this element of it. So we're going to pilot it for 2 years, and we're going to take those metrics and we're going to put them into the Crisis Now system. We're going to see how it all works together. Oh, it's working. Great. can we operationalize that through another fund source? I think all of that's possible, but it all requires really defined goals. And I think, to me, that's what's been missing in the alcohol tax. And that's what also makes it hard to articulate what we're doing in the alcohol tax. I think it also allows the alcohol tax to be subsumed by emergencies because we aren't goal focused. And I am a huge advocate in trying to better balance the funding in the alcohol tax somewhat proportionally or towards where we're weighting what our goals and objectives are. Thanks.
Mr. Rivera.
Yeah, thank you, Mr. Chair. So a few thoughts from me. So, when it comes to any recurring funding, whether that's the unified funding proposal or other types of recurring funding, I think even though I think as member said, any given Tuesday, we could change things up. I think it would behoove us to make sure that we have conversations with the organizations that we are currently funding and sort of let them know, wink, wink, nudge, nudge, that you can't rely on the municipalities' funds forever, and that they should start looking at other funding sources. And I think that gets to some of the ideas that members have talked about of, using the alcohol tax as sort of startup funding, where you can rely on the alcohol tax, and we will make a promise, even though we can't put promises on future assemblies, but for at least right now, we will make a promise that for 3 years we will fund you. But after that, you got to look for your own funding outside of the alcohol tax. I would like us to move towards that kind of model generally. There may be some instances where having recurring funding that maybe is more long-term makes sense. But moving away from that conversation, ever since we started the alcohol tax, I have never been satisfied with the reporting that we've gotten. Unlike other funding sources, there are really strict requirements in the alcohol tax around metrics and reporting to see how we are moving the needle and the goals, which we've never really set, as Member Alochol has alluded to. And if we're moving the needles and the goals, then hopefully we're moving the needles in the overall buckets of the alcohol tax. But that picture is really hard for any of us to describe because we've never really done that work. And so I appreciate that, all of the framework in that the Member Brawley and the others have been working on is, I think, an attempt to move us in that direction of being goal and metric oriented. I will also say that proportionality to me really should be centered around the goal. If we have a series of goals that tend towards, as an example, child abuse and sexual assault, then I'm okay with if half of our goals for, let's say, as an example, FY25 are around child abuse and sexual assault, then I'm okay with that proportionality, meaning half of the funds go to sexual abuse and child abuse and sexual assault. So that's sort of where I am thinking in terms of proportionality. Thanks.
Yeah, it's an interesting conversation and a tricky one. And I think it's the right question. We should exercise great care when we're making commitments over time because of the challenges of doing so. Okay, Ms. Brawley.
Yeah, thanks. And I appreciate the discussion. I think maybe to keep us focused on what we want to do with next year's tax. And I know there's a lot of these questions, right? It's not that we're going to walk out of this room saying, here's where all this money's going to go. But I guess on my mind, again, getting back to the fact that there are things that are already happening, they're recurring, there's things that are one time, and there's potentially, some room to play with there in terms of available budget to make choices on. I think the question to the members and also to the administration to think about two big questions. What is something that either we are not currently funding or we're not funding a lot, right? Like we've talked in the past about substance misuse has not gotten a lot of the money, right? Just that's how it's been to date. So where would you want to move kind of toward funding something more, I think that's a question, or something that we haven't been funding that we should be funding. And then the other big question, I think, just to put on the table, it gets back to the point about proportionality. The reality for the last 3 years has been there's been budgets passed, and then a lot of that money doesn't get spent for various reasons. And so there's fund balance. And that's why some of these, it shows over the amount that we collect every year in some of these budgets for the year, because it is fund balance as well. By not really by default, but just the reality is a lot of that has gone to homeless response, and I think that's gone to a lot of really good uses. And so I'm not saying that that was a bad choice, but it was a choice, right? And it's one that was partly out of necessity, partly out of the absence of, I think, other kind of big ideas that were brought forward that were competing for those funds at that point. And to Mr. Rivera's point, there are valid reasons to put money toward those things, or make sure that they're in our goals. Anyway, all that to say, I think that is another question for us going forward, is especially as we think about how to pay for things like shelter that we have been paying for through the alcohol tax, is how much of it, again, not a specific dollar amount, but generally, how much of it should we continue to put toward that particular use? Because it's in my mind, it's been that versus a lot of other priorities that maybe haven't been fleshed out, or ideas that we haven't fully funded, essentially. So I want to put those two things on the table, really. What should we be doing more? What are you interested in doing more of that we're not doing now, or not enough of? And I think, again, just the question that we have to wrestle with is how much do we want to put toward homelessness? And then that gives us an idea what's left, essentially.
There's a more complex question there, but first Ms. Braga, then myself. Go ahead, Ms. Braga.
Thanks, Chair. I'm sorry, I was trying to jump in earlier, but I told Ms. Brawley that I couldn't find the rubric, because in teacher speak, a rubric has a 1 through 5 or 1 through 10, and you can easily circle. I feel like what would make this so much easier, and I know that I am part of this and I will work on it. I should have thought of it before, but coming up with number that are served, and you circle a number up. Is it upstream funding if that's the priority, and you give them a score on that? In progress, reports are timely. Have they come up with matching dollars? Do they have a long-term plan? And does it meet the goals of the assembly? Questions like that we could have a scoring rubric that we circle numbers, helps me.
Okay. Does that exist now, or are you saying that should be created?
I think we need to create that. In my mind, I think that would be a helpful tool. We have everything here, but a way to match up different organizations with a score.
Right. Okay. So then it's on the specific grants that have been made, some form of scoring for their performance relative to what we set out to do. Is that what you're saying?
Right. I'm sorry, there's such an echo. I'm getting a little confused but the idea is also to help decide who gets the funding. If we have a simple rubric that's easy to compare different organizations, are they coming in asking for money with a plan? Are they willing to put some effort in to find matching funds? I was thinking of what Ms. Kerr said in the housing and homelessness meeting, that that would be an easy way to compare different organizations and decide which way our money should go, along with our own priorities as an assembly. But also to make sure that a report is done. I mean, I think in the education world, we're really used to you have a report due by this date, and it's not real onerous, but it actually, you have to say what you did with that money. And I would really love to see that. Thanks.
Thanks. So I just would sort a little bit of that and say that some of that, like reporting requirements and requirements for delivery, probably fall into the administrative side. But if we wanted to say something along the lines of this grant or this program has a matching fund requirement or other specific tools. We have done that and can do that in the future, which is to set up some forms of kind of commitments by the organization. So it wouldn't probably be that we would pick organization A, B, C, or D. Generally, if it's through a procurement process, that's the administration. We would just see the results. But I think your point really, if I might restate it, is to have some elements of requirements of performance that are reported to us, so we can determine if they're qualified and continuing to perform, which is reasonable. So I have myself in the queue next.
Correct.
So two things, just to put a little fine point on what you were saying, Ms. Brawley, like it's easy to say in the abstract, do we want to spend less on homelessness? But it's hard when the expenses are going to be there. So then the real question is, what other budget items do we intend to fill that gap with if we're going to take this money and do something else with it? So there's a two-step process there. Like if we're removing an expenditure here so we can fund something else, then where are we cutting that money from in the other part of the budget? Or are we moving away from the commitment to operate year-round shelter? Or are we, anyhow, it's a two-step process. It's not simply asking ourselves, do we want to reprioritize this? So I want to make sure that's really clear for folks. And then in terms of an actual priority relating to substance use disorders for 2025 budget year, I want to put on everyone's table that we will be standing up through a contract or through a procurement process, Anchorage Center for Treatment or some form of that, which is a requirement under the consent decree with Providence and MLMP and the Chugash sale. We have capital money that's being spent on that. There's an RFI out right now, an RFP coming soon. And so there is very likely a substantial substance use disorder operating money specific funding opportunity coming up to us this year, and it will be part of the conversation. So just by virtue of the tide, the SUD bucket is likely going to be before us in a very specific and concrete way over the next several months through the end of the year and through the beginning and middle of next year. So that bucket, if folks feel like it has been missed, don't you worry, it's coming. And I say that recognizing that some might see I have a conflict because I work for a substance use provider, 50-year anniversary, but we're not a bidder. We're not responding to the RFI. I have no play in that arena. So I just put that out on the record now. You won't see my organization as a bidder on this. So I feel very comfortable talking about it and participating in the debates about the field from my many years of experience on the subject. So should that change, I will bring that information before the body. And next I have Ms. Alochol, then Mr. Volland.
Thanks. So this is a request to the administration. I think what you hear in our conversation is a lot of work needs to be done. There's not a lot of money in the alcohol tax. The alcohol tax is a fiscally constrained bucket of about $14 to $16 million, and these are really big issues, is to help us investigate other funding sources for these priority designations. I know there are a lot of them. There are federal pass-through dollars that come through various departments. And like with the mobile crisis team in particular, we piloted it and then we found a different fund source in a department's budget. So really laying out that menu of options for us, I think would be really helpful because some of them have really strict rules. There are federal dollars that come in that have really strict rules, caps on the amounts that can be spent on various items, but really starting to create and educate us about that because we haven't talked about how these things intersect very well. These things happen over here in this silo. These things happen over here in this silo. And the assembly is involved in all of them, but we're not strategically hearing how we're going to move the various pieces to achieve the overall goals. So I think that the conversation will become really ripe really quickly, probably like in the next month. So just kind of a heads up, particularly as you hear about the competing priorities. And then I think it's also an invitation for members, if you have a particular priority that you don't see how there's room to get it into the alcohol tax or not immediately or fully into the alcohol tax, to ask the administration to help you investigate the fund sources coming into the municipality to achieve that as well. I look at the alcohol tax as very flexible funding within the dedications that can be braided and leveraged to like really significant impact. So anyway, I'm gonna get off my soapbox, but I think it's a really important aspect of this money is that it is so flexible within the dedications, whereas a lot of the federal and state dollars that come into this area, these areas in particular, are way more restrictive. Thanks.
Ms. Vaughn.
Thank you. Yeah, I have a couple thoughts. I like Member Baranga's idea of having sort of a score sheet to go along with the rubric. I think at best it's going to be like a sample score sheet for each individual member's evaluation. Because I think that's been like the tension of this whole project, right? Is that we are 12 members, individual members, all of us with the prerogative to bring forward any funding proposal that we so desire. And then it's up to our colleagues to vote to move that forward or not. And it could be that I say that there's an entity in the community doing a program, and to me, I think it's of an enormous value, but maybe they don't meet the sort of ticks on the score sheet, right? And then there's the things where we're not doing like a directed grant to a specific project or specific group. We are just putting it out to the administration. This is the goal. So for instance, I think this is a timely conversation because on Tuesday we have a resolution before us from Mr. Martinez that wants to essentially request that the administration partner with the Assembly on exploring funding, including alcohol tax funding for after-school programs, whether that's sports related or any type of different after-school program helping families in need be able to access those programs. And so that'll be before us on Tuesday. And I guess that's where like my head is at, is like, I want to know what are we expecting to keep funding in the next cycle, because we don't want to lose the complex care facility, et cetera. And then what's the remaining, what is that more flexible portion as we target out to 2025? And is that Access for Youth initiative, could that be like an example of one of those things we want to pilot, test the proof of concept, see what the value is, get the metrics, get that return data, see how many families were able to participate, and then we can decide, is there a different source or do we want to keep that going? So I guess just, putting a flag in that, I think that's the tension that we're always going to have with this it's a policy guide, but any member can bring something forward and make their case. Thanks.
And, it was briefly spoken by myself in the queue now again, that the mobile crisis team was a good example of a project that was stood up with alcohol tax and then using SEMT funds, which are Medicaid generated revenues from fire department's transport services. We were able to move over the funding to the SEMT funding, notwithstanding any problems with accounting that might occur from the audit issue. We're waiting on final information. So, but that said, not every project is going to have a very handy funding stream associated to it that we can just port to. But that also said, we've been in discussions with the fire chief, and I think the capital outlay, the financial outlay to secure a 24/7 mobile crisis team is the hiring of a number of additional clinicians. I think it's somewhat maybe 5 more full-time, very expensive hires. But if we do that, that turns every hour of services delivered by that team, direct services, into a billable service, which could generate tens of millions of dollars of revenue, tens and tens of millions of dollars, which could be, again, the same way we could reset the clock, if you will, the financial clock on the expenditures if we can get there. And so we have to focus on two sides of the equation, like the money coming in and the money going out, in order to be able to achieve all of our goals, or expand the achievement of our goals to include more and more of the priorities we hear from the community. So I just want to keep that revenue side as a very important part of the conversation. Ms. Alochol.
Thanks. So one of the things, review last year's funding goals and success. I'm wondering where priorities and goals, there's something missing from this evaluation rubric. And I think it's how did the tax function in its administration? The alcohol tax has been clunky and hard. And We've heard from various grantees that it is really hard to access, that they're not always certain. And I think we've made some improvements, but I think that somehow in how we measure success, and we've heard this a little bit, and we did that pilot to the Children's Trust to see what grantees they reached that we're not reaching, right? So I think the reach and the ease of these funds, particularly for smaller organizations, and really looking at the equity of that reach are also important ways to look at success for this particular fund source. Because, right, if we go back to the buckets and who's disproportionately impacted by child abuse, sexual assault, domestic violence, homelessness, substance misuse, what we find is it's the BIPOC community. And we really need to make sure organizations serving those communities can easily access these funds. And those organizations are often newer or smaller. And it shouldn't be such a sophisticated fund source that it's hard to access. So however we want to capture that, the note is there, Ms. Brawley.
Right, Ms. Brawley.
Yeah, thanks. Because I want to recognize we just have an hour today, but I think this is really raising some really good questions and really hopefully getting folks thinking about moving forward through the budget process. So briefly, we'll continue through the rubric, but I just want to know, so we're looking at assess the current status of priority issues. It is also important to note that in terms of our role as assembly, this is where we maybe would be breaking off, and we wouldn't personally be answering a lot of these questions, but really looking to the administration and working collaboratively to figure out what this looks like in future years. But I'll just note we have, and these are really, I think the questions we've started to dig into of some of the issues that we prioritize for the current year's funding or next year's funding. Does alcohol tax address those at all, right? So again, are there things where we could be beefing up or we haven't been investing, but we want to? Are there other funds or other groups working on this? So I think partly, who's out there, who's already doing this work, but also to Member Alochol's point, what other fund sources are there that can be utilized as well or instead? And then if it's not being addressed, the issue that you're interested in, how could alcohol tax be used to make that change? So again, I think these are questions that we've already been discussing. But I want to kind of ask again, too, if anybody has, whether it's from the assembly side or administration side, if you have ideas or issues that you would like to put on the table in the mix. And I'm seeing Joe wanting to say something. So we could just spend a few minutes doing that, again, just as an initial conversation.
Thank you very much through the chair, Member Raleigh, for that inquiry. Joe Busa, Deputy Municipal Attorney. I'm here on behalf of Eva Gardner, the Municipal Attorney, to highlight the dire need, one way or the other, to increase pay for municipal prosecutors and to ask the Assembly to consider prioritizing alcohol tax funds and helping to meet that need. Our municipal prosecutors do an extremely difficult job 365 days a year. They're in court on holidays, on weekends, and we are struggling. Severely struggling with recruitment and retention. In large part, that is because there's just not enough pay. The pay has to increase to be competitive with other opportunities that attorneys have in the city. Currently, we have 9 municipal prosecutors working. We should be up to 16. That's the fully funded level. We are actively recruiting for all of those spots, but the pay is just not high enough. A very large percentage of the crimes that office handles deals with domestic violence. And here's the connection to the alcohol tax fund and considering prioritization of alcohol tax money for the team of attorneys who should be handling exclusively domestic violence issues. At a fully staffed level, we estimate there could be 5 attorneys devoted entirely to dealing with domestic violence crimes. And in order to do that, we just have to increase attorney pay. And I want to highlight that this is not really a matter of simply throwing more people in jail. Obviously, incarceration is one tool in the toolkit, but a municipal prosecutor deals with more than just that. It can also include connecting people with resources regarding substance abuse, possible diversion programs, but it takes prosecutors to do that work, and we just need more pay one way or the other. Thank you.
So two people, myself and Ms. Alto, just so members are wondering, I discussed with the municipal attorney, them coming and presenting this because the conversation has been ongoing upstairs about what are we going to do about this. And since we're discussing alcohol tax today, so in case anybody's wondering if that came out of the left field, was invited. Ms. Alto.
Thank you. So I previously worked with the municipal attorney when it was Kate Vogel and then Blair Christensen. They did an analysis in the civil division of pay, and they came up with a plan, and it had a multi-year implementation. So if we could see something similar for prosecutors, I don't necessarily understand the intersection of the municipal attorney increases we already added if the prosecutors were exempted, or if there's that tool already to use and we just need to move it in the budget. But you can consider myself a partner to work on that. I think it's an important issue. And I think that there's a public safety bucket here that's pretty broad, and actually once we took the mobile intervention team out, that is proportionally very low, and something that the public expects to see. So I think there's opportunity, but I think that analysis is going to be really important, and just wanted to make you aware of that prior work that had been done so you don't have to reinvent the wheel.
And I would just add one last note. In my discussions in the community relating to homeless abatement and, citations for people being terrible in parks, not just the encampments, but the people who are perpetrating, and the triaging that's going on in the decision-making to actually prosecute it's not at the level of should we be prosecuting these more petty things. It's at the level of at what level does an actual physical assault get prosecuted, because we don't have enough bodies to do that work, right? And so if you're thinking about it in the context of prevention of domestic violence, and you want to be careful of not creating a stream of pipeline to jail or any of those conversations, what you're really doing if this conversation comes to the table is lowering the line at which the decision is made to prosecute when somebody's been assaulted. It's really grim. Anyhow, so that was more specific than probably anything we'll hear today. But Mr. Myers.
Just wondering if you have an analysis of what the pay looks like compared to the state's prosecutor's office or even the federal. I'm sure it's lower, but I'm just wondering how much lower are we?
Sorry, through the chair. We are preparing that analysis. This is one of our highest priorities in the office. I can tell you for sure it is lower, and we are working to address that.
And there are some willing victims who made the choice to leave high-paying jobs to come work here, but we can't count on that. Ms. Alochol.
Thanks. So I'm going back to Ms. Brawley's question of what would we like to see in here? I think one, and Mr. Constant alluded to it, is of course we're going to need some kind of startup money for the Alaska Center for Treatment Operations. Previously, all the way back when the alcohol tax started, it was about $500,000. So that's just a dollar figure to maybe put in your head. And then what I'd like to know a little bit more, when we look at the 2023 alcohol tax spending, under each of the buckets, there are program operations. When we list our funding that way, that tells me nothing about what's actually happening. I need to know, is that grant administration or is that some particular program? Because if it's grant administration, I want to maybe tease that out. I know we've talked about administration in terms of who collects the alcohol tax and through the treasurer's office, but program, grant administration to me is more administrative cost versus possibly going into the substantive area of the bucket. And I think that shifts some of that proportionality. So I think it's really important to tease out what we mean by program operations, because if you look in public safety, it's just over $860,000, but in child abuse and neglect and the prevention bucket, it's 54, and in homelessness, it's about $550,000. And so it varies widely. So I think knowing what we're talking about there will also be helpful, so that we can start to look at, are we at all, even if it's making the tax go, are we duplicating it in any way as well? I think what I would really like to see is that somehow OMB, the Office of Management and Budget, really wrap around the grant process for the alcohol tax and administer it in conjunction with the departments to streamline it and really give some relief to those departments. If we were to pick for instance, if we were to pick a public safety grant of some sort, and would the police department administer that grant process? Probably not. And so really making that a lot more easy and frankly, possibly taking a little burden off the health department's plate because we seem to dump everything at the health department where we find no other good place for it. Thanks.
And I would like to see then, since we have program operations broken out into each of the categories, I'd like to see a separate table that is all of the program operations money
I know.
with the color coding in place so we can see which subset it's from. But it would be nice to understand how much of these funds are being used for administrative purposes on our end, because
Yeah, no idea.
there should be a reasonable amount available for this. And it's hard to tell having it broken out this way if it's reasonable. And it's also hard to tell if one department's operations expenses are substantially higher than another, and then understand why that might be. And so it would be interesting information. Go ahead, Claire.
We just got from OMB right when this work session started, so I'll send it to you, but budget to actuals for each year, which is the first time that we have seen them that comprehensively. The reporting had been pretty poor before that. And so I pulled, actually, I didn't pull all of this. Our team that's working on the Cheers to Anchorage website has been compiling this data, but most of what you see on this is just pulled from the budget documents. So I think that's maybe a note to OMB to put more detail in there next year if it's going to funding just programs at an existing department.
I think the program operations could be defined then, because I didn't hear that that's what it was for operating programs targeting the alcohol tax kind of goals. I understood that to be, this is the cost of administering the program in that department. And if I've got that wrong, then it would be great to understand the differential there, because we should budget an amount for operating the grants for the departments. And it should be reasonable, because if we don't, then we continue to have a situation where it's not implemented, right? Because we don't have bodies to do it, because we didn't budget for it. We kind of learned this lesson in ARPA that, we should have spent a little bit more on management than we did. But I also don't want one department to have 30% management costs and another to have 5% management costs. We want to figure this out and see it. And so it'd be great information for us to understand and be prepared to fund, because if we want programs, we need to fund them, not just the grants. Anna.
Yeah, thanks. And I think that dovetails with kind of some of the immediate next steps that are identified in this plan as well, as far as improving those processes and administration. And then I'll also note, I know over the last, having tracked this budget pretty closely in a prior life, in my prior work, I'm aware that some of these labels have changed as well, and some of the categorization. So I think there's some kind of tracing back to what these were, and there's anyway. And then I'll also note that I'm making a list of things to follow up with the OMB director, because I think there's some more information beyond the budget format that would be helpful. Like, for example, there are positions tied to a lot of these funding items if they're within the municipality. And again, I think we should understand that as we talk about potential changes or improvements and all that. So all that to say, I know we only have a few minutes left. So I'll just briefly move us to the next part of the rubric, but really not so much to discuss it in detail, but just to note that we also want feedback on the rubric. And I appreciate Member Bronga gave some feedback, and then you folks have brought up a lot of these questions, right? What should be carried forward? Looking at these strategies, are there specific strategies that we could be pursuing? Do we need to balance out the short versus long-term investments, right? I think a lot of these questions we have put on the table already, but if you have feedback on the rubric itself, in addition to what we've already said today, please send those to Claire. And then I'll just see if there's any other comments that you want to make in that spirit. Are there changes or suggestions or other things that we should think about in this document?
Ms. Alochol.
Thanks. It's my understanding, I'm just going to use this as the opportunity, that social workers in the library are funded in the current alcohol tax, but there are not social workers in the library. They need to go to the library, please. Please, please, please. So all of you very smart people, work out where the money went and how the social workers can get into the library, please. Because we have done this 2 years in a row and our appropriation has basically been ignored. So you're getting a little past stuff coming up, but please help us fix that. Thank you.
So I'm not hearing or seeing anyone else. Thank you, Member Brawley, for lead. Oh, Ms. Ross?
Since we have a couple minutes, and did you like the edits that I made based on your last conversation to this policy guidance? Any feedback on that? Yeah, so I did get that. I figured I could just in the mission section write parentheses behavioral health after mental health and substance misuse, and then leave that notation at the bottom.
Ms. Brawley?
Yeah, thanks. I'll take another look and I'll send any specific comments, but I also want to point folks to page 2, these 5 goals. So if you remember, we had very broad goals that we incorporated now into the vision statement. And I know we don't have time to get into detail on these, but I think what we have drafted here is not what everybody has said, yes, this is what I want this to say. It was a first draft. So I just want to, again, point people there and also point members of the administration to there, because I think the idea was to have more specific goals that speak more to alcohol tax, as opposed to saying we want housing for everybody, which we do. The alcohol tax isn't going to pay for all that, right? So please take another look at these in particular. And if you have suggestions of where we should focus or things that you don't like about this, because I think that's really the biggest piece that is the barrier to us moving this forward and getting this plan passed. And so again, we don't have time to figure that out today, but we need to keep working on that. Thanks.
Claire?
Even though today we are just using this 4-page guide, I just wanted to remind you all that there is a larger document. So some of the questions, as you're thinking through the rubric of, what issues do we want to prioritize? If there's an issue that you want to prioritize, I encourage you to go back and look at the full strategic plan, because there's a lot of great ideas that came from a lot of research in the community of ways to approach those issues.
With that said, thank you, Member Brawley. Thank you, everyone who's participated. Mr. Buse, thank you for speaking up from the administration. We like to hear from the administration in these work sessions. It's allowed, it's welcomed. Some of it's quiet eye contact across the room. Some of us speak to each other without words. But with that in mind, I'm thankful for everybody doing this work, and I do look forward to us engaging in a more robust budget process that is back and forth, as I mentioned before, so that it's more harmonized. And with that, we're going to be adjourned for the next 10 minutes. We'll be back for our last work session of a very long day in 10 minutes. Thank you.